All right, Ken Thorpe is here with us now, and he is with the Rollins School of Public Health at Emory University. We've got a lot of questions from people all over who are wondering about healthcare reform. What does it mean for me? Not just the small business owner that we saw right there, but other folks who are saying, I have pre-existing conditions. What will this mean for me? So let's kind of tick through some of them. Dean is asking, can we expect our insurance premiums to increase while we wait for the bill to take effect?
Well, it's a good question. We're hoping that the states will continue to do a vigilant job at really regulating health insurance premiums. Most states require health plans in the individual and small group market to submit premiums. There's a determination if they're fair and actuarially justified. So in the interim, we're going to have to rely on the states to continue to provide that function for us.
And of course, we've already heard a number of states through their attorney general are actually suing to see if this is constitutional, if there's a way in which the state can say, we don't want to be forced to enforce people to have health care insurance. Diana asks this, my daughter was denied health insurance last week due to a pre-existing condition. Is there anything we can do before 2014 when many of these conditions kind of kick in with health care reform?
Well, that's one of the good news parts of this legislation. Really starting within the next 90 days, there's going to be a national high-risk pool for everybody. So if you have a pre-existing condition, there will be a health plan available to you that you can't be denied. And starting this year as well, children cannot be denied coverage based on pre-existing conditions as well. So those are both pieces of good news in this legislation.
All right, this is good news for her. This was part of that mantra where the president said this year, these things are going to happen. This was one of them. Dave said, I thought the health care premiums would not increase unless you were earning $250,000 or more. Now it's $88,000, and is that gross or taxable income?
Well, what the legislation does is raise taxes on families over $250,000 in income. If you're an uninsured family of four, let's say, under $88,000 in income, you'll get some financial assistance to buy coverage. So, for example, a family of four who earns $40,000, they pay about $2,180 for a health plan that costs well over $11,000 in the open market. So that's a very substantial amount of financial assistance to help them buy health insurance coverage.
These figures are mind-boggling, aren't they? And Bill asked, the health care bill makes huge cuts in the Medicare program. What does this mean to Medicare patients? Will coverage be reduced? Will costs increase? Will doctors refuse to take Medicare patients?
Well, in the traditional fee-for-service Medicare program, most of the savings are really putting more efficiencies in the program, trying to find ways to keep people healthier, reducing readmissions to the hospital, keeping people out of the hospital in the first place. There are new benefits in the Medicare program as well for seniors. A health risk appraisal, a personalized care plan. Starting in year one, you'll get a $250 rebate if you have a lot of expensive costs for your drug benefit. So there are a lot of new benefits built into this for seniors that kick in this year.
And a lot of times prescriptions, a lot of seniors have to make a decision. Do I eat? Do I get my prescriptions? So many are saying they look forward to that. And let's go to this last one. This from Mary. And sadly, this has become a very typical scenario. Mary says, I have no insurance, a pre-existing condition, and no money to buy anyway. I'm 57 years old. What does this mean for me?
Well, within the next 90 days, there's going to be a plan available to you to buy health insurance that you can't be denied.
60 days.
So I'm sorry, 90 days.
90 days, okay.
90 days. So the Secretary of Health and Human Services has to develop a plan available nationally that can't discriminate against people with pre-existing conditions. And the premiums are going to be subsidized, meaning that there will be financial assistance to help you buy those premiums as well. So for somebody in that situation, again, this is very good news.
Wow, hopefully she can hold out for another 3 months then. Ken Thorpe of Emory University, thanks so much. Good to see you.
Oh, thank you.
Appreciate
Thanks for having me on.
I know we'll have you back because I know people still will continue to have a lot of questions as we inch closer, whether it be to the 90 days or just over the next course of weeks to understand it. Thanks so much.
Thank you.